Hi, I'm Denise Smith, and I'm the program manager with Rise Vermont. I want to welcome you to the Rise Vermont TV show. In partnership with Northwest Access TV, we're going to be providing weekly insight, inspiring ideas, and stories about how to live healthier, happier lifestyles in Northwest Vermont in the counties of Franklin and Grand Isle counties. Thank you so much for joining us, and we hope you enjoy the show.
Hi, this is Jessica Frost from Rise Vermont, and today I'm so happy to have a special guest with us, Kara Bior from Choice Physical Therapy, and she's going to share some exercises that you can do in the workplace or at home to help keep our bodies strong and everything in line and healthy. So hi Kara, how are you today?
I'm great. How are you?
I'm great.
Well, I'm here to talk to you about the pelvic floor today. Probably an area that most people don't think to exercise. And if they do, it's kind of like a quick side note from a doctor maybe to do something that they call Kegels.
Oh yes.
Have you heard those before?
I have, especially after having children. They always tell you to do your Kegels.
Absolutely. But they never tell you how to do them, right? I have found that most people when I teach, including myself, actually when I went to my first course, we do them wrong. We do them very wrong. So very wrong that it's not helpful, which I think is why a lot of people stop doing them or they figure they've done them enough. But working on your pelvic floor is something you should do through your whole life. Oh,
wow. Yeah, I know I've always heard that message at the doctor and do it. They say, well, do it when you're at a stoplight. But then I forget, and I'm very inconsistent with that sort of thing.
It's hard to, but if you can find that thing that you just said, often I tell my patients that to do it at a stoplight. The ironic part is if you can find a designated time to do it or a designated thing that you're going to do it at, like a stoplight or before your lunch or before each meal, you can try to get yourself into a routine. The hope is that you understand why you're doing it and the kind of benefits that it would have for you. In which case, if you know, then it makes it much more of an important priority for you to do it.
Yeah, so maybe we could start with what are some of the benefits? Why should I put the time into making this a routine?
So pelvic floor dysfunction can happen for a number of reasons. Both men and women actually can struggle with that. People who have chronic constipation can do damage to their pelvic floor, damage that can be resolved, so it's not permanent damage. Men who have prostate issues or have had a prostate surgery, women who have had babies, like you said, people who carried multiple births or multiple children, that can really do a number on the pelvic floor. But as we age, the pelvic floor changes, and so just an aging process is a reason to do it. The pelvic floor is a set of muscles that are basically, if you think of your pelvis like a bowl, it kind of sits on the bottom of the bowl. And they're muscles, and they're meant to have a low-level strength that kind of holds everything in place. I'm sure you've probably heard of people who have something called a prolapse, which is your organs kind of falling out of your body. And that would be because of changes to the pelvic floor, whether it's muscular changes or it's fascial changes. Fascia is connective tissue that you can't control, but it's very important. If it's just pelvic floor weakness, muscle weakness, that's something that you have control over, and that's the kind of changes that I would teach my patients to be able to deal with. Fascial changes are changes that you don't have control over, and so you may need some outside help. Like, I'm sure you've probably heard of mesh slings and things like that. Well, the world is kind of changing in that dynamic, but it may come to a point where you would need a surgery. But that is so far beyond of what A, I'm going to talk about, but B, they always want you to try to work on the muscles first and see if the changes can happen.
If you can strengthen the muscles, can it help prevent some of those fascia changes down the road?
Yes, yes. So the stronger the muscles are, the more control you have. And it holds things in place. Besides just holding organs in place, we talked about prolapse. Incontinence is something else that the pelvic floor has control over. So There's two different kinds of incontinence, well, three. There's a stress incontinence, which a lot of women will say, I laughed so hard I peed my pants, or I sneezed and I leaked, or I tried to get up off the floor and I leaked. A stressful situation that causes increased tension in your abdominal region can put pressure down through the pelvic floor and cause it, if it's weak or if you do it a lot, to lose its tension. The pelvic floor encircles the two openings of where we would go to the bathroom, so around the urethra and also around the anal sphincter. And so those muscles are needed to be strong to keep those tubes closed, basically the tubes that exit the body. Without that strength, there's nothing to hold back the urine into the bladder. And so those muscles need to be strong to overcome the weight of the urine that fills the bladder.
I've also heard of, jumping rope being challenging, or going on the trampoline with the kids.
That downward
Yes.
pressure of your body,
Yeah.
exactly. And sometimes as we get older, it's even just gravity.
Yeah.
Gravity can play
Yeah.
a role. You don't even have to jump. So Kegels is the term to use for doing exercises for the pelvic floor. These particular exercises are mainly for people who have some weakness or have good strength and they just need to keep it. There are a group of people that have tension issues where the pelvic floor actually is too tight. It's not allowed to relax. Now, when you go to the bathroom and you sit down, there's a neurologic loop that your body goes, oh, we're on the toilet and it's time to go to the bathroom, and the muscles relax. There are some people, for instance, ones that have chronic constipation or have had issues like anal fissures, which are very painful when you go to the bathroom. Little kids have it a lot too when they're having difficulties. It hurts to go. And so their body like clams up and it doesn't relax. And so for people with those issues, you kind of want to do what we call a reverse Kegel. You want to learn how to relax them. And as I talk a little bit later, we'll talk about both, on how to contract, but also how to relax, because they're both equally important.
I have found too, when I'm consistent, I tend to have less lower back problems. A lot of times my lower back goes out, but when I'm doing my Kegels and thinking about it and activating it, especially as I'm moving, my lower back feels much better.
Yes.
So is there a connection there
There
too?
absolutely is. So the pelvic floor is the only set of muscles that directly connects to your tailbone, which is the sacrum, but it's the bottom of your spine. We think of the whole pelvis as the center building block. If you don't have good control through the pelvis, then it's hard to build control above it or below it. The other connection is that when the Kegel is happening, when the pelvic floor is engaged, there is a tendency for your deep transverse abdominis muscle to kick in, and they kind of helper muscles. A lot of times if I have a patient that's not giving me as good of a contraction as I know they have or could have, I cue them to try to pull their deep transverse abdominis in, and that actually will help the pelvic floor contract better.
Okay.
So there is a very direct connection between pelvic floor and the back.
Yeah, it's just amazing how everything is connected and all these little pieces really work together to keep your body strong and stable and prevent
Absolutely.
injury.
Absolutely. You'll notice if you've ever taken a Pilates class, a lot of times your Pilates teacher will cue your pelvic floor before you go into it. Same with yoga as well, depending on the teacher. The big part that I would like to make sure that people really understand is that anytime that you exercise for whatever body part you're working on, it's really important to breathe. Not only because you need to breathe in the oxygen so that your muscles have something to work with, because they need that or they cramp, but the exhale and where the exhale is. The exhale should be on the work. And most people do it the opposite.
Yeah.
They exhale when they're relaxing. Now, the reason I'm saying that is because a lot of times people can do damage to their pelvic floor because, for example, a sit-up or a crunch. When you do that upward motion, that should be your exhale.
Okay. Yeah.
And because of that, because you're exhaling, you've opened up one end of your tube, okay? If you do the crunch and you hold your breath at that point, you're increasing that intra-abdominal pressure. And I think I said earlier, when you do that, it pushes down on that pelvic floor and it actually causes it to not be able to contract and hold in. When you exhale, you allow that pressure to not build up in your abdominal area. You can keep the pelvic floor engaged and you continue to breathe.
So anytime you're contracting, think about exhaling.
Yes.
And you release, do your inhale.
Anything. Bicep curls. The work is the coming up. That's the harder part usually. The slowly lowering is actually difficult too. But the intra-abdominal pressure would come from the work of lifting. When people do that chest press, it's the exhale when you push. All of that, all of those increasing pressure changes in your body, you need to make sure that you exhale for it. Helps the pelvic floor stay engaged. So do you want to learn how to use your pelvic floor?
I do,
Okay.
yes, I'm ready.
So there's some do's and don'ts.
Okay.
All right. So some do's. When you contract the pelvic floor, what you should feel is, I call it the elevator. So when the pelvic floor contracts, because of its placement in your body, it's in the bottom of that bowl we talked about. You want to feel the center of the bottom of your bowl lifting. I always tell my patients, sometimes when we're talking through while they're doing their work, you want to feel that pelvic floor is rising all the way to the penthouse, if you think of it like an elevator. And you really want to try to get it lifted as far away from, if you're doing them in a chair, from the chair as you possibly can. And then when you relax, you want to have it come all the way down to touch the chair. So that's talking about returning to that ground floor where you would start on an elevator. So, and then to relax, which we'll talk about too, you want to actually feel like you're pushing down into the chair. I find that once you're on a chair like this, your sit bones kind of keep you a little bit away from the chair. So I have told my patients to either grab a hand towel or a washcloth. So I'm going to give you my hand towel, and I would like you to sit on it like you would be sitting on a bicycle seat.
Okay. And just before we go on, we do want to make sure that the men out there are joining us, because it's also very important for men to do these too.
Yes.
Sometimes we think of it as just a female issue, but okay, so that's my bike seat.
So what you're feeling for, both men and women will feel, we call it a winking, an anal winking. So you'll feel the anal sphincter area pull up and in, okay? Women, you'll also feel it towards the front near your clitoris. When you do a Kegel, the clitoris moves a little bit. So that's how you know you're doing it correctly. You'll feel those 2 areas for women and the 1 area for the gentleman. So as you're sitting there, to do this correctly, you only want to feel yourself where your saddle area is, where you would sit on a seat, pulling up and away from that cloth. The cloth is there to give you a little bit of proprioception. You kind of miss that when you're sitting on a regular seat. So now you'll be able to feel yourself pull away, come back down to it, and then gently push into it. Things that you don't want to feel. You don't want to feel your whole bum clenching. If you rise up off your chair when you're doing it, you're doing a butt glute set, okay? And that is not your pelvic floor.
Yes.
You also don't want to feel, when you're really concentrating on just the pelvic floor, your knees squeeze together. I don't know if you ever remember being a youngster and your parents going, don't do the pee-pee dance. We kind of walk around with the cross-legged. Ladies, sometimes we end up there too. We end up getting trigger points in our inner thigh muscles because those are the wrong muscles as well. So you don't want to feel the knees pull together, and you don't want to feel the butt clench. All you want to feel is your saddle area pulling up and away. Depending on how weak you are, and that you'll know by, if you leak, have an incontinence issue, how much do you leak? Does it only happen when you're sneezing and coughing? Does it happen as you're getting out of a chair? Does it happen as you're getting out of your car? If it happens more often, chances are you're probably a little weaker. Depending on how weak you are, same thing with going to the gym. You don't want to stress an area with more weight than you can do. So for a Kegel, there is no real weight at this point. There are other options down the line, but at this point, there's a time factor only. So you want to contract the muscles as long as you can do it without making anybody else come in.
Yeah.
Some people say, I can hold it for 10 seconds. And you look at them, they're like this, and their body's all clenched up because they're using every other muscle. So as long as you can keep it isolated to just the pelvic floor, you can do that. So as you're sitting on the towel, what I want you to feel is that pulling up and in. The muscles that you're using are like the muscles you would use if you were to sit on the toilet to stop to pee. Now, that's not something that you want to do more than once. You just want to make sure that you know that you're using the right muscles.
Yeah.
Same with holding back gas. Those are the muscles you want to use. So you want to feel the pelvic floor rise, contracting. You want to feel that area pulling up and away. Feel that anal sphincter winking a little bit, all the way to the pelvic floor, taking it all the way to the penthouse. You'll feel the tummy engage a little bit, and then you want to relax. The most you want to hold it for is a 10-second hold.
Okay.
I usually tell people start between 3 and 5 seconds. When you relax, you want to feel yourself come all the way down to where you were resting before. Sometimes you don't come all the way down, and it's really important that you do. Give yourself enough time to come down and rest. When you're all done, around 5 to 10 repetitions is as much as you need to do. 5 for the weaker, 10 for the stronger. And you want to do that somewhere between 3 and 10 times a day.
Okay.
Depending on what you got going on.
Yeah, so it's not a huge time commitment. It's not
isn't.
like I need to set aside, 10 minutes to do my Kegels. Just kind of work them in.
And you can do it sitting in your meeting. You can do it while you're sitting at the
No one
computer.
knows if you're doing
Nobody
it right.
knows, exactly. When you're all done with your repetitions, you want to feel things kind of bulge. So the sensation is very gently, don't push hard, like you're trying to have a bowel movement. That little bit of push down, and what you should feel is that saddle area touching even more into that towel, and then relax.
Yeah.
And that's to make sure you have a nice stretch at the end. Just like any muscle in the body, it also needs to be able to stretch and relax.
Okay, yeah, that's interesting.
And there's your Kegels.
Yes, well, thank you.
You're welcome.
Our WIC access code today is workplace. Yes, this was great. I feel like it's much more attainable and approachable now, and it's something that can really just start to work into your day little by little.
Absolutely. The key is that no one knows you're doing
Yeah,
it. If
yeah.
you look like you're doing something, you're doing it wrong.
Yeah, well, thank you so much.
You're welcome. It was a pleasure.